Let's get started. Thanks everybody for coming. Appreciate it. This is the VCU Department of Internal Medicine Grand Rounds. Today is December 5th, 2024. Today, we have a special session. We have invited our arts and healthcare, music and arts, and other programs to come talk about their setting and also offer an interactive experience. So if you are online and you want to come downtown, feel free to come down to the MCV campus. We are in the Molecular Medicine Research Building, first floor. So to get us started, today's title is Arts in Healthcare, an overview of its uses and benefits in the medical setting. We have two speakers today and performers or trainers. I don't know what the right terminology, instructors. Melissa Owens, who is a music therapist, and Alexis Shockley. Alexis is the manager of the Arts and Healthcare program here at VCU. She has a master's in fine arts from Radford University and completed the VCU L. Douglas Wilder School of Government and Public Affairs, Graces E. Harris Leadership Development Program in 2020. As a manager of the Arts and Healthcare program at VCU, she oversees and advises the VCU Health music therapists, music and medicine faculty orchestra, arts specialists, volunteers, interns, and several VCU clubs. She maintains the health system's 3,000 plus fine arts collection while curating new works throughout the 49 buildings that VCUHS maintains. Before joining VCU in 2018, she has worked as a K-12 art teacher and a gallery director previously. She prioritizes community outreach, program growth, patient experience, and team member support. Melissa Owens is a certified neurologic music therapist and a board-certified music therapist here at VCU. She has been here for 22 years. She's also a member of the Virginia State Task Force for the Mid-Atlantic region of the American Music Therapy Association. Melissa enjoys speaking on the distinctions between clinical music therapy and entertainment or bedside musicians in the medical setting. Musical therapists have a degree in music therapy, must be board certified, and follow strict code of ethics and standards of practice and engage in ongoing training and education to fulfill requirements to maintain their certification. The music therapists at VCU Health provide services to more than 2,000 patients every year. Please help me in welcoming Alexis to come up here and get us started. Yep.
Hello, everyone. Thank you for having us. It's always exciting for us to be able to share with the folks here at VCU, VCU Health, and the Children's Hospital what we do at, in the Arts and Healthcare program. So we provide supportive care to our patients, our visitors, our team members, and the community through art instruction, music therapy, health and wellness, visual arts, and cultural programs. We have been around since 1986. We've been serving patients, started with just an art cart, where we would go patient room to patient room and let them pick out the art for their space. We have grown immensely over the years, and we're excited to where we are now. We want to connect people with the power of the arts, key moments of their lives. It decreases their anxiety. We aid in their physical, mental, and emotional recovery and reduce their perception of pain through the arts. We have a small but mighty team with a lot of future growth coming next year. I'm the manager. We have an art specialist who does the art installations and also the bedside art sessions. We have two music therapists. Melissa is one of them, and Molly Luck. We also have a music coordinator who coordinates our VCU Health Orchestra and Wind Ensemble, Teresa. We have interns, externs from VCU. We have volunteers from U of R and VCU as well. We're starting an artist in residence program. We have two art therapists coming next year and an event coordinator as well. So today I'll be talking a lot about, or not a lot about, briefly about our healing environment and the support that the arts can give you as team members, but also that you can provide your patients. We aim to have a healing environment through the visual arts and through music. So you will see original art in all of the patient-facing areas, but also prints in the patient rooms. There should be art in every turn you make in the hospital, and that's something we prioritize. We have, our collection is worth over $3 million. We have 49 buildings that we take care of. ranging from sculptures, ceramics, original prints, etc. We have 2 different galleries where we support local artists. So this is a really good opportunity to you yourself go and take a break from work, walk around, look at the new art. Also, our collection is a great opportunity to de-stress in the environment. And we also like to give back to the community by giving local artists the chance to show in the hospital. We have a lot of team member support programming. That's something I really prioritize in arts and healthcare. We have, you can see a NICU retreat on the left, middle, a Paint Your Pet, the mural at Shore that we just did a few months ago. Opportunities for team members to just take a break from work and come and do some art. We also have a VCU club that I advise, Muse. This is students at VCU, biology students, med students that find art to be de-stressing for them. So they want to give back to the hospital, our healthcare providers. So they come and they have a club of over 60 students right now that volunteer their time and come and do art sessions on the units with team members. It's been really well received. On the far right, you'll see med students. We went to Chore Tower, our safety team. So keep that in the back of your mind if you ever want to sign up. The sign up geniuses go out monthly. We also have a lot of employee support programs. Right now, the craft sale is going on Main 1. If you have the opportunity to walk through there, that's all support of our team members. It's all their crafts and their family members' crafts. So we want to really let the other talents that our employees have shine in any way possible and encourage them to use those talents to de-stress in their own time as well. So we have the National Arts Program. It'll be our 20th year next year. You've probably seen the art in the hallway in August. The lunchtime concerts. Every Wednesday we have music. The month of December we have music every day up on Main 1. We support the cultural programs. We work hand in hand with the DEI program to do MLK walks, the cultural festival, the employee festival a few months ago up on Main 2, where you could come and learn about all the different supportive programs that we have. And lots of support during Healthcare Worker Week and Nurses Week. So now we'll talk about patient care. These are just some pictures of us working with patients. In the healthcare setting, where patients' sense of control is often lost or minimized, the arts serve as a therapeutic and healing tool. It reduces stress, loneliness, the perception of pain. The arts improve the patient's experience and have a positive impact on health outcomes. These benefits further lead to shorter hospital stays, less need for pain medication, and enhanced patient adherence to treatment, resulting in substantial financial savings for both patients and the health organization. So art instruction is one of the branches that we have. We get referrals from nurses, doctors, social workers, chaplains. Patients themselves will refer to have art or music bedside while they're inpatient or outpatient. We offer any sort of art materials, sculpture, sewing, jewelry, painting, anything they want. If we don't have it, we go get it. And this is all free to our patients, all of our services. So we'll visit the patient, we'll discuss what their interests are. One of the things that we like to really brag on is when we come in that space, we're one of the few team members that do come into that space and ask them what they want, what they need, how can we help de-stress during this time. And we like to be partners with the healthcare workers as well. We'll find that we'll get calls from the nurses, doctors, providers saying, this patient is really, they just don't want to take their medication anymore. They're really, really anxious right now. Can you please come up and see if they are interested in music therapy or would want to paint today. And I mean, it's really, really impactful to see the adherence of patients. It gives our healthcare workers an opportunity to just take a break from that patient as well, because then the patient is calmer, more relaxed, adheres more to what they need to be doing at that time. Some of the benefits of art instruction is a patient's stay is shortened when art is part of their care. Art is highly effective in easing anxiety and depression. It can inspire health and well-being. It creates a therapeutic engagement between healthcare workers while reducing tension in the workspace. It's a welcome distraction for team members, patients, and their family members. It also gives family members a moment to also leave the room for a little while, go get a coffee, go de-stress themselves. And you will probably notice I've been saying art instruction, not art therapy. That's very important for us to distinguish between the two. Like I said, we hope to have 2 art therapists coming next fiscal year. Our art specialist has a degree in art, but does not have an art therapy degree. So there is a big distinction in the care that art therapists can provide to our patients and therapeutic or recreational art. So that's a very important distinction. And now I'll give the floor to Melissa, our music therapist, to talk a little bit.
I'm going to try to breeze through this kind of quickly so we can get to the really fun part. Hopefully it'll be fun for you. There's a lengthy definition of what music therapy is, but I like to say that music therapy is the use of music to accomplish non-musical goals. Our goals as board certified music therapists are not to teach a patient a particular musical skill, teach them to sing. We may want them to use their voice. We may want to engage them in playing an instrument, but it's not for the purpose of specifically just learning to play an instrument. And I'll explain a little bit about that later. So specifically, medical music therapy is the use of music, and that can look a lot of different ways. And I will explain that as we go through this, to address physical and emotional needs of patients due to trauma, illness, disease, injury, all of the above. And so our goal as music therapists is to find what the needs are of the patient through the referral process and through our assessment, and then determine what we can do musically to help them address those needs based on what their musical interests are. And music therapy works because it affects the brain and impacts processing by providing stimulating and structure to the brain, including timing, grouping. All of these sorts of things are already the natural elements of music. Timing, all these sorts of things tie in very, very nicely to music, and also helping patients do what we need them to do. It can help us synchronize for better organization, and it recruits parallel brain systems. So music is a whole brain process. So rather than being left or right brained, and we hear talk about this, music actually involves the entire brain. And so where there may be deficits in one area of the brain, musical memory can still be retained. And so that's something really important for us to acknowledge here. So how can music therapy have a positive impact on the brain? Well, there are a lot of different ways. It stimulates, as I said, multiple areas of the brain. It can improve cognitive function because of the repetitive elements of music. We can help it regulate brain function. It can facilitate neuroplasticity, so there can actually be changes that occur in the brain with the kinds of things that we're able to do through music. And when I say music, it's both making music actively and also engaging more passively in music that's provided by a music therapist. Music can improve mental and physical well-being. I think we've all probably had those days where get out of work, all you want to do is turn your radio on. It kind of helps us decompress. It's very normalizing. It's something that we're all very familiar with, and it's a kind of a natural part of what we do in our day. And so music can be very comforting to people, and it can also kind of help us, stop our work day, unless you're a music therapist, stop your work day and focus on something like music. Improving motor function. We like to collaborate with physical therapy and occupational therapy and engage patients in instrument play and things that might mimic things that they're working on with their other therapists. If they're working on feeding, we can work on drumming to help them work on that movement. And so while we don't set specific physical goals, we do collaborate with PT and OT to help come up with music therapy strategies that would help to address those. And of course, communication. Many of our patients can sing when they can't vocalize otherwise because of maybe dementia or Alzheimer's. And so that's also very important. So music therapy, what it is and what it is not. It is research-based. In order for something to be music therapy, it has to be provided by a board certified music therapist who's completed a degree and an internship. We are held to very high standards for continuing education and recertification. I think I mentioned earlier that we work toward non-musical goals, and it's very important for us to use music that is individualized to each patient. We don't prescribe a specific type of music. We ask the patients what they're interested in. If Johnny Cash is what really floats their boat, that's what we use in music therapy. If it's rap, if it's classical, we will have to, we switch gears quite often throughout the day, depending on the patients we're working with based on their musical interests. And it can be effective regardless of a patient's musical ability. So they don't need to be able to play an instrument or even be able to carry a tune to benefit. One of the things that's really important to distinguish between is music therapy and what music therapy is and what it is not. So having someone turn music on for a patient in their room is not considered music therapy. Patients having headphones listening to their preferred music is not considered music therapy, or a non-music therapist playing music for a patient, or the live performances. So we're fortunate that we're able to get both here. We're able to have the things that the general population can engage in while they're walking through the facility, and also things that can be done bedside. So we receive referrals throughout the health system for all the different areas, adults, pediatrics, and we receive referrals from medical staff, social work, psychology. Really, it runs the gamut. Even some family members will ask us to see patients if they see us in the elevator with our guitars and things. Our reasons for referrals and our goals overlap a little bit. So I'll talk about the most common reasons for referrals. We try to help patients reduce perception of pain. If we have patients that are in a lot of pain, or patients having a lot of anxiety, patients who are under a lot of stress, patients who have fractured family relationships, a lot of other things going on. Maybe they have secondary mental health issues, or maybe they're here for a mental health issue, but they also have other medical issues. We are often called bedside as patients are being weaned from ventilation. We're called bedside as patients are actively dying, to provide music, to provide a calming environment for the family, and also a soothing environment for the family, so that the lasting memories they have with their loved ones are not chaotic and high stress. They remember singing to their loved one, or listening to music, or providing a suggestion for a song for their loved one, which can be very meaningful. So family support is very important. We want to help improve coping for our patients. It provides sensory stimulation. It normalizes the environment, as I said earlier, because music is something most of us enjoy and benefit from. It can support our patients' autonomy. They get to make the choices. They get to decide whether or not they want music therapy at this time or that time. We don't insist upon them receiving it at a particular time of day. They're able to make some decisions about the care they receive and the sessions they have with us. If patients have altered mental status, we are able to work with them and help regulate mood and things like that, and provide reminiscence for those who have dementia and other age-related types of things. And I did mention life review and anticipatory grief. That's a lot of what we do in palliative care and in some of the ICUs. So a lot of these kind of carry over. Music can help decrease physical tension. It can lower blood pressure and respiration. Music can help improve cardiac output, relax muscle tension. Some of these things we'll hopefully experience a little bit when we engage in some music together. But I'll let you just look over those briefly in the interest of time. All right, so one of the things I didn't say that's not on the screen that I want to cover quickly before we get into the music component of this is that music therapy can look like a lot of different things. Music therapy might look like a music therapist sitting bedside with a patient who's intubated and sedated, playing music because we know they can still hear that. It might be working with a patient to express how they're feeling. It might be writing songs. Patients may not be able to, or may not prefer having conversations about people about how they're feeling, but they might be able to look lyrically at a song and analyze the lyrics with the help of a music therapist, and pull out the things from the song that really relate to them. You know, I might say, you know, I notice you keep choosing songs that have to do with the relationship with mother and child. And they might say, well, yeah, because I have a very strained relationship with my mom. And then we might be able to engage in that. And so everything we do as music therapists, you know, as part of a team, you know, that information that we receive may not be something that a nurse will receive or someone else working with a patient. So we're able to carry that information to the team, and hopefully that will be something that can be addressed through the people that can appropriately address those types of things. So you may pass by a room and see us singing with patients. Sometimes we are working to help patients vocalize. I worked with a young lady yesterday who was extubated day before yesterday, and she was singing yesterday. We're working on getting her voice back, having her used to using her voice again. We do a lot of instrument play, with drums, large percussion instruments, small percussion instruments. A lot of people enjoy drumming to get out their frustrations. It's a little harder to do that in the medical setting because we don't want to be too loud in the areas that we're in, but when we do groups, on psychiatry or in pediatrics, we're able to be in areas where we can do more of those types of things. And we do sometimes do music instruction, but our goals are not necessarily to teach a musical skill. It might be to improve self-esteem, provide the patient with a leisure opportunity, something that they can work on while they're here in the hospital for a long time. So what we want to do today is do some more active things rather than just talk about what we do, because this is the fun part of it. And we all experience stress in our lives, whether it be in our home life, in our work setting, and sometimes simply the act of actively making music can be relaxing. One of the things I should have mentioned is that we have a lot of instruments that anyone can play. You don't have to have any musical skill to play. These specific instruments are called easy percussion, and they're created. Can you all hear me okay? These instruments are created specifically. This is called a pentatonic scale, so it only has notes that blend well together. Do we have any musicians in the group? No, so that sounds really fancy. Pentatonic scale. It's actually great that we don't have musicians in the group for this purpose. But anyway, these instruments are created so that no matter what you play, they sound amazing. You can't make any mistakes on these instruments. This instrument here is called a happy drum, HAPI, that's the brand. And I have put little green stickers on the instrument that you have to play specifically. What we're gonna do, we're gonna experience a little bit of what it's like to make music and all, let me put one more thing on that. To make the music and also relax in the process. If we have a larger group, we might, kind of split the group apart. So I need some volunteers, please. Don't want to drag you out of your chair. So I need about, let's see, we'll have at least half the group. So at least 1, 2, 3, 4, 5. Yeah. We could just get everybody up and then not do the switching that we were going to do. That might be better since we want to have time for the art too.
Let's see how I ask myself some logistical questions.
Yes, sure.
So how do we consult you? Is it an Epic consult or do we?
All right. So apparently there's a way to put it in, but it doesn't come to us. So don't do that.
Okay.
I'm glad you asked that. Thank you. For any of our services, you can call our department, Arts and Healthcare, but our cards have our information on them.
Okay.
And phone call, message us through, you can message us through Epic.
Okay.
Or just call.
Just arts and
Or
healthcare.
email.
Yeah. And is it Monday to Friday business hours or?
Monday
is
through
it-
Friday business hours.
Okay. Because our patients tend to be most bored on the weekend and I can see like
Yeah.
they get frustrated and
Yeah.
they're like, I'm
The
not doing
nice thing
anything.
is when we do have patients that are really interested in doing things on their own. We can provide them with things that they can use over the weekend.
Oh, okay.
So I will leave instruments in patient room, show them what to do. Is there enough for everyone to have one?
There are 2 more.
Yeah? Well, how about?
Young guy.
You and him.
Yes.
So dramatic.
All right. So,
Forget a guitar.
all right. So first of all, just take your mallets. They're either attached or not to your instrument. And our goal in making music today is going to be twofold. It's going to be, I want you to be thinking. Yes, this is the hand part. Good question.
I can have one.
It's not-
You have to coordinate.
Okay.
Markland's only got 2 little.
Good luck with it.
And are you practice just making sounds with your instruments? All right.
There's always one.
Already. Okay, so what I would like to do is we're going to, I want you all to be able to relax also, but I also want you to kind of put yourself in the frame of mind If you are working with a if you have a patient that, if you were a music therapist, I guess I should say, and you want to do something calming, so our goal is to play something nice and calming, kind of a slow tempo. So I'm just going to play something very simple on guitar. Okay, there's no right or wrong. Whatever you're doing is not going to be wrong. But I want you to just come in whenever you can, and we're just going to kind of get into a good groove.
I didn't laugh when you got that. That's the best. The happy drum solo right now.
Yeah. So good. So we have to do something that we can, so we can combine music and art together. So if you want to go ahead and make your way back to your seats, I do want to just ask you a couple of questions after you've done it. So I want you to be thinking about how you were feeling when you walked in today. Did you get? Okay. I feel like I forget about the online
Yeah.
people. Sorry, online folks. So I want you to think about what your morning was like. You may have had a wonderful, perfect morning. I personally had to clean up after a sick dog this morning. So that's how my day started. So a little bit stressful. So either when you came to work this morning or when you entered this room, think about, what your thoughts were. Were you thinking about what you needed to do later today? Were you, in a super great mood? And then I want you to think about if there was a difference in how you felt, either while you were playing music or after you played the music. And I guess I'll pass the microphone around if anyone has a comment so that the folks online can hear.
Definitely, the activity was very uplifting. And it's not only about producing the music, but also doing it in a group was really, really, really uplifting for my mood.
Great.
Yeah, it was a reprieve from the stress of the day, which was nice. And I agree with Hermes that there was this sense of connection, and those poor people online that didn't get it. I feel bad for them, but we were sitting here laughing and enjoying and smiling at each other. And Dr. Syme kept trying to touch my wind chimes, but it was great.
We may have put some people to sleep online, and that would not be necessarily a bad thing. Does anyone else have anything to add to that? I just basically want to, talk a little bit about and have you all understand what it's like for a patient who might benefit.
I was actually only thinking about the music and not the 2-hour meeting I had before, which I was thinking about when I walked in.
Very good. So this is what we hope happens for our patients, right? We want our patients to be able to actively engage. Did you particularly find it difficult? No, not particularly difficult to do.
So as an observer, so I'm back there pretending I'm a family member in the space or a team member in the hallway. I was smiling and I was relaxed, and it changed maybe my nerves about being here, the things I'm thinking about and the trip coming up, things like that. And I was able to relax as just an observer, not even participating. So that's a whole nother layer to it. Yeah.
And that's what we hope happens. A lot of times when I mentioned fractured family relationships, sometimes I will encourage families to engage. They don't even have to be, looking at one another, but I can say, why don't you play something on this for your mom? Why don't, you take this, and it can be this beautiful experience with the entire family, and it can be very healing in many different ways. And so we want to move from the music portion to the art portion. Alexis will tell you exactly what you want to do, but I want you to take the same feeling that you had coming in and then coming out of the music when you create what you're creating today, because you're going to be using words that hopefully will help maybe articulate either maybe a personal mantra for yourself, or how you felt coming out of doing the music or during the music itself.
All right. So this is going to kind of bring in a few different techniques that we do bedside with patients and with team members in our groups. This is just a watercolor postcard you have in front of you sitting on the little plastic sleeve. Watercolor paper can hold water, can hold Mod Podge, so it's a good sturdy piece. It's really funny. Some of the students didn't know what postcards were when we got these for them. They wrote on them upside down. It was funny. So I'm going to walk around and show. We're going to do some collaging, ripping. As you notice, there's no scissors out. The process of ripping is very, very relaxing. It also makes you step out of your comfort zone where you may want something to be precise. So I just created a little landscape collage. And then when I was done with my collage, I went over and I picked out a word that I felt was inspired from my imagery, or a word that resonated with me at that time. Maybe you need a word. You can make a word out of the letters you see in there. Maybe you need some hope right now. Maybe you need healing, something like that. So what I want you to do is just look through the magazine. Don't think too hard about it. Just tear some pieces of beautiful imagery, shapes, colors. You may see a apple pie, but the crust looks like a really cool border. Don't think too hard about it. And you're going to use that Mod Podge and that sponge brush to coat the underlayer of that watercolor paper. It is glue. Mod Podge is a very overpriced Elmer's glue. That is all it is. It dries clear like glue. So put that down underneath, and then you're also going to put it on top to seal it once you've done that. You don't have to cover the whole paper either. You'll see peaks of white in mine. Sometimes allow that negative space to show. When you also can go pick out your word first. It's up to you. Find your word first, be inspired by your word to create your imagery. Don't think too hard about it. Just enjoy the peace and quiet of just ripping, tearing, gluing, creating. You will probably surprise yourself with how it ends up looking. Different shapes. You'll want to wet as you go. Once you find a nice little pile, you'll put the Elmer's glue down. I'll get you a plate of some. Also, another layer of this is that sometimes family members I've worked with, patients, pediatric patients a lot, they like to make gifts, presents. They're missing a holiday, they're missing a family member. So maybe you're missing a family member, maybe you're missing somebody, you could make this for them. So it's a lot of opportunity to think of others, to do some internal healing. Yeah, all right. I do have scissors over here hiding if someone really needs them. I don't want you to feel stressed because you do not have scissors to cut out a word that you did fine, so please come and get some. Cover coming over the edges at the end with mine, I just went around and cut all the over. So allow your that.
Can you remind our folks online how logistically they would make a referral or consult?
Sure.
So I don't think
Absolutely.
they heard the conversation.
Yeah. So if you do have a patient that you feel would benefit, maybe they've showed interest in music. They've talked to you about how they miss playing the guitar, they weren't able to bring it, or music relaxes them, or they're bored and they want to do some art and you don't have the supplies that you would need to provide for them, give us a call. We have up on the slides our contact information. You can leave us a voicemail. You can email us securely with the patient information. You can also message us in Epic. All of us check our messages in Epic daily, and we'll just need any pertinent information about the patient that maybe we can't see in the chart. Information that you've gathered from the patient that would help us to come, through that door prepared to meet with them. So. Good question.
Often, for music therapy, we often will receive calls to work with a pediatric patient of an adult, perhaps in palliative care. I had a young man one time whose father was actively dying, and he was the young man was about 14 years old, the son, and he wanted to write a song for his dad. And so that's what we did. We wrote a song for his dad, and then we went bedside, and I played guitar and he sang it to his father. So in those instances, we certainly can do that. And actually, a lot of what we do benefits family members, regardless of whether or not that's the initial referral reason, because when we're in the ICU with a patient who, is intubated and sedated, we can engage more actively with the actual family member and help them as well. Yes. That happens often with family members, especially young, children and teenagers. They just feel kind of lost, and they just kind of sit in the corner and look at their phones, and so I might engage a teenager by saying, do you know what kind of music your mom really likes? And they may say, oh, she really loves The Wizard of Oz, and Over the Rainbow is one of her favorite songs. And so it might be something that, while the patient might not be able to actively engage, I can play that and sing it, and maybe the teenager will sing it along with me. And even though they didn't, they weren't the ones who actually played the guitar and did most of the singing, they still gave a gift to their family member through the music therapist by asking for that song, so that, they know that, mom, one of the last things she heard was her favorite song. And it was because I asked the music therapist to sing it.
Yeah, I have actually a lot over in the Children's Hospital infusion on the first floor. A lot of siblings come along for the infusions, and maybe the child who's having the infusion doesn't want to participate, but I've worked with siblings of patients, do art with them as well, so that, it helps the parents keep, helps de-stress everybody when there's something happening for support in the room. So to answer your question, I don't, maybe not a direct referral for a sibling per se, but you could, refer for that patient, and then we could provide care for everybody in the room. Mm. Yeah, so the comment was that there's a lot of patients nearing end of life and need support, and I think that that's a good time to engage us so that we have that relationship built with the family. You agree, Melissa? Begin working with them so that, yeah. Because that's kind of, like I was saying earlier, I didn't say this, but we strive to be there from right when a patient is admitted, not necessarily 3 months down the road when it's an emergency call from the team members, like, oh, they're getting so bored, they're really not taking their medicine anymore. But instead we have that relationship and they know to call us when they start seeing those signs so that we can be there and we have that relationship. Mhm.
When we put in the order in Epic for therapeutic treatment, I forgot what it's called exactly. This sounds like it doesn't go to you guys.
No, that's something that we've been really working on. Melissa and Molly, our music therapists, have been really working in Epic. I actually just had an extern from VCU, a PhD student. She just finished up her research. She went to every single unit in the entire hospital and conducted interviews about our program on the units, asking, do they know about us? Do they know what we do? How can we better provide services? How are you giving referrals now? And how can we better get referrals to you? She's actually doing her presentation next week on her data that she's collected. So hopefully from that, we will really be able to dial in on our best way to provide our services and communicate with the units, because that is something, obviously, because I had her do this research, it's something that we really need to work on. And we've really been trying to get that figured out. So yes, it would be more message us directly.
How about engaging like staff members in group sessions?
Yeah.
Art or music, if there's anything around that that's been helpful?
Yes, actually, this isn't set, and Melissa's gonna probably kill me for saying that I really want to do this still. But I just went to a National Organization of Arts and Health conference out in Texas last month, and there was some group keyboarding that was done with team members, and they did a pre and post survey on how the team members felt before and after the music session. And I'm really, really hoping that our music therapists will do something like that here and do what you said you had, something that can read the cortisol levels, was it?
There are things out there.
Okay. And we would come and provide these music sessions to educate about music therapy. It would be kind of an all-encompassing, educate about music therapy, share with the benefits, but also benefit from it yourself by de-stressing. So that's something we're definitely looking into doing. Currently, we don't have any music sessions for team members, but we do have the Muse VCU Art Club that provides about 6 sessions a week throughout the hospital. On the units, come right to you with all the supplies for an hour and work with the units. So that's what we're providing currently.
I'm a geriatrician that deal a lot with dementia patients.
Mhm.
We have worked with George Mason University has done some work around dementia and music, but it's more outpatient and kind of research focused. I don't know, here in the Richmond area, have you guys run into anything done in the outpatient setting to kind of blend this in some high-risk populations?
As you can see, we are very small. We are having trouble. Our music therapists do a wonderful job meeting the needs of our inpatient population. Outpatient is definitely something we want to begin providing care for. We would definitely need at least another music therapist to be able to provide offsite sessions. With the two upcoming art therapists, one would be for the Children's Hospital and one will be for the adult population. I think we do have an art therapist and a music therapist possibly still at Virginia Treatment Center for Children. I'm not sure if they're currently there anymore, but I mean, in a perfect scenario, I do have a 5-year plan for the program to where we would have someone that could go to our offsite outpatient centers. We do provide art and music to our patients in our outpatient clinics if we receive referrals, which we don't receive too many. We do in the emergency room, in the Massey infusion centers, in the peds infusion and dialysis areas.
There are quite a few music therapists in the Richmond community, though, who do work in a lot of facilities with patients who have Alzheimer's, dementia, and other sorts of things, and they do really wonderful work. So there is a lot in the community, and hopefully in the future we'll be able to do some of that as well.
But well, you got the cat magazine. So I'm going to ask you while I'm standing right here, how do you feel that when this was in front of you, did you feel like it was a little bit daunting, or did you feel like I can do this? I'm relaxed. I'm ready.
I feel like I could do this.
Yeah. Yeah. It turned out beautiful. And
I do wood.
yes,
So I
you
need
do.
I need a table saw. That's
Hey, hey. See, if you were a patient and you were a woodworker, we do have a lot of wooden items that we do provide for patients. Not a table saw. Do not have one of those. I have a lot of things, but not a table saw. Maybe a little Dremel, but bedside Dremel probably would not be very good, huh? But look at that. That looks great. That's okay. See, that's with collage, you don't have a plan. It kind of comes as you're doing it. And those that are online, this is something that you could really do from home. Everyone is just explain what's happening. Everybody has just a magazine in front of them. They're tearing out pictures and pieces of images and using overpriced Elmer's glue to put it down. So if you have a child or you have Elmer's glue at home, you can do this and just glue it on a piece of paper. You're done? Let me see. Oh, I love it. That's great. So I will say when you're done, take that Mod Podge and seal it. So you'll kind of just it'll dry clear. Yeah. So put it on that and take that sponge and just cover it totally. If it's buckling up, nope, you just set it right on.
You have a cat?
I don't have a cat.
So
So
you're
get
gonna
right under there.
I think it's my subconscious for me to
Get a
get cat.
You'll just kind of put it like this and just seal it really good.
So like on
Mhm,
or
yep,
inside.
all over it. Like it might ruin it, but it won't. It'll dry clear. Dries pretty quick.
And then
Yep, and you just leave it.
leave it like
Yeah,
that.
and we'll dry.
One thing that I forgot to mention is sometimes people want to know how often we see patients. And we typically see patients 2 to 3 times a week, sometimes daily, depending on our schedule. Right now, I've had quite a few discharges, so I have patients that I'm able to see daily. And our sessions last anywhere with really young children, they might be able to make it for about 20 minutes. But for some adults, we're with them for 30, 45 minutes, even as much as an hour. We see them throughout their admission. Sometimes we receive referrals and patients aren't interested in music therapy because they think they have to be able to play an instrument. And so it often will take a time or two of us just being there and playing for them to actually actively engage. But we try to see patients as often as possible.
About 5 minutes left. Just wanted to see if anybody had any other questions.
Is this a competition? Is there a competition?
Yeah, what's the prize?
Can artists present their work? You want to present your work?
Yes, please.
You all would like to, sure.
Should I talk about my work? I would be happy to talk about my work.
So the theme of my work was thrive. And I have as part of that people, some faith and the great outdoors, all things that can make people happy.
Love it. Anybody else want to share theirs?
So my word that I put on was warmth, which I actually cut out of the magazine. And I just was going through and it's a little chilly in this room and definitely cold outside. And I saw lots of great reds. There was apples, there were maple leaves of a tree that was in autumn. And then there was cranberry sauce and pies. And then I moved over to the National Geographic and there was lava. And so I just made this great little thing of collections. Oh yeah, sure. Put it, go ahead, hold that up. So warmth and made me feel good because it's cold, it's dark and gray, and it's that time of Dr. Simon thinks we should have an exhibition hall in the Department of Medicine. We could do that. Anybody else want to discuss their work?
I did a bunch of animals, and my word is hope, because I hope that all living beings in this world live in peace and happiness.
Oh, I love that.
Can't see all of them. I'm trying to. Oh. So this is the artwork that we got here. Let's see. Anybody have any comments about what you see?
That one on the screen.
Yeah, sure.
So this is Ramez as this is going up. He had to step out to make a phone call as chief residents do, but he if you want to make it a little bit lower, Christian, there we go. So he matched in cardiology fellowship at Chicago yesterday. And so he's got, yeah, that one. He's got the bean there at the bottom left, which is, famous Chicago icon. And then there's that cat. And I said, oh, fresh start is his word. And I was like, oh, that's great. And I was like, I see you have a cat, or you and your cat going to move to Chicago? Because I don't have a cat. So, so maybe this is him wanting to get a cat. Yeah, I know. That's what we said. So we'll see. Maybe he'll get a cat. Keep him company in the cold winters in Chicago.
Anybody else want to talk? Got a couple other ones here.
And are there any questions? Do any of you have questions before we wrap up? Because I know our time is coming to an end. We want to encourage you to reach out to us if you have any questions, if you want any more in-depth information about what we do, or certainly if you have questions specific to working with patients with music therapy or art, or any of the other kinds of things that we do with staff.
I will say that we are adding, I know I had health and wellness as something that we do on the weekends. I know you said that folks are getting lonely on the weekends. I have a woman, Ruslana, who she's a death doula. She does sound sessions. I have her coming to North 4 every weekend, and I just pay her contractually, and she comes up for several hours on the weekend, and she works with our patients on North 4. 15-minute sound baths. And the stories, I have her chart to me, and I share it with the nurse manager on North 4 on Mondays. But the stories are, this past weekend, she worked with a patient who had tremors and was in so much pain by the end of the session. Her eyes were closed, her tremors were gone, and she was just profusely thanking her for being there. So I'm trying to pull in as many of these kind of other practices. I have a harpist that's going to be coming and playing in the environment on some of the critical care floors. She's done a NICU CD of songs for the NICU, specifically like lullabies that she can play on the harp. So trying to provide those kind of, and those would be in the evenings. So she would come kind of at 5 o'clock, the witching hour in the NICU, or some of the other critical care floors that can't really participate as much in our other therapies. So trying to pull in those other elements in the evenings and on the weekends to support them. So, yeah.
All right, well, thank you both, Melissa and Alexis. Thank you so much for coming. This was really fun. So thank you so much.
Thank you. And I'm gonna take a picture of all.